Thank you. Now we now turn to the state of Florida for the automated community connection to economic self-sufficiency. And Don Whitsted is at the microphones already, and Jennifer Lang is here with him. Thank you both.
Thank you. Good afternoon. The world of customer service has changed. When I flew to Boston for this presentation, I traveled on an electronic ticket purchased online. I checked myself in at the computer terminal at the airport, and I printed out my own boarding pass. In Florida, we're using many of the same technologies to improve customer service for applicants and recipients of Medicaid, food stamps, and temporary cash assistance, while decreasing cost and improving effectiveness. We call our business model Access Florida. Let me contrast how Access Florida works compared with a traditional public benefit program. In the old model, people apply at agency offices. They generally fill out paper applications and other forms, spend an inordinate amount of time waiting to be seen, and go through an extensive interview. The interview might be conducted with the aid of a computer terminal, and customers wait as staff go through the tedious process of key entering their information. We used to call this technology. In Florida, families needing help now can apply anywhere, anytime, using the Access Florida web application. Customers enter their own information. While people may apply from any computer that can access the web, they can also go to a variety of other sites. We have over 2,500 community partners. Partner sites include workforce one-stops, health clinics, hospitals, homeless shelters, public libraries, and many other locations. At a partner site, applicants can access a computer to apply or check on the status of a previous application, drop off or fax information to us, access a helpline telephone to get assistance in using the technology, or simply find out about the status of their case. They can also visit agency offices, but they won't find the same process they did a few years ago. Today, our lobbies have self-service computer terminals, greeters to answer questions, and telephones to access helplines. Plastic chairs have been replaced by upholstery, and seating areas have been redesigned to reflect a more professional environment. To improve service, call center agents are available by toll-free number. We have 3 customer call centers in Jacksonville, Tampa, and Miami with over 500 employees. When our eligibility staff review the web application, they're assisted by an automated process the technology folks call data streaming. As a former eligibility worker, I call it magic. The web application moves the information at lightning speed into our mainframe computer system, pausing when necessary for the eligibility worker to make decisions to authorize benefits. Another important part of the process is document imaging. Our staff constructed a web-based document management system to which commercially available scanning devices connect. These devices permit documents to be digitized and indexed so the information is available to eligibility staff using our secure network anywhere in the state. There are no more paper files. So far, the results have been remarkable. In 2002, we had slightly over 7,200 eligibility employees. Now we have 4,109, more than a 40% reduction. At the same time, our workload increased. We had about 1.9 million public assistance clients in July 2002. Now we have about 2.2 million. Annual cost to taxpayers has been reduced by $83 million. Since we've implemented the web application in mid-2005, acceptance by Floridians has been astounding. In March, 89% of our applications were electronically submitted and e-signed. Of those, 70% came by internet, that is from home computers or computers in partner sites rather than our offices, which are connected by intranet. We also asked customers to complete a satisfaction survey at the end of the application. In March, 81% of more than 30,000 respondents said they were able to complete the application without help, and 90% rated the experience either easy or fairly easy. While we've made significant improvements, we're far from finished. We're moving toward a system where customers will manage their accounts online through a web-based system that talks to our main computer. use of data matches to automate verification of identity and citizenship, and card swipe technology to access case files are also planned. The access model is highly adaptable across the country. Representatives from more than 40 states and national organizations have visited to learn more about our process. We welcome the opportunity the Innovations Award would provide to share our experiences more fully with others. Jennifer and I will be glad to address your questions.
Thank you. David Osborne, his first question.
I'm just curious what effect this has on the rate of fraud. Does it? You've expanded. You're using a lot of community partners. Does that create a greater danger? Does the technology make it easier to catch people who are trying to cheat the system?
Part of the process changes that we put in place where we expanded our front-end fraud prevention staff, and we give them special data tools to try to catch problems up front, and we haven't seen the kind of increases you would be talking about.
Yeah. Ellen Shaw.
You note that you've achieved $83 million worth of administrative cost savings in a year. I wonder if you could say where those funds went and whether the department made any effort to reinvest them in services.
Yes, actually, that's a net figure. We actually saved more than that, and we did invest in technology, and some of the technology that went into the document imaging and scanning equipment was generated by savings above the $83 million. The $83 million in ongoing savings, almost half of that was federal match money, which this is money we don't draw down. The other half is state general revenue reductions, which the legislature would have the ability to program to other needs.
So none of it went into expanding services for the population you serve?
Over and above the $83 million, there were savings that went into changes in renovating our waiting rooms and new technology, but the $83 million is actually a net annual figure.
Maria Echaveste.
As I understand the application, part of the genesis of this was the intention for outsourcing, of going private. So can you explain to me how that process appears to have also had this, it seems, unintended consequence of actually improving the relationship between the client, if you will, the customer? Is it by accident, or how did this?
No, it was not by accident. There were multiple goals. You're correct. There were really multiple kind of triggers for this. One was hurricane season. When the 2004 hurricane seasons, when Florida was hit by 4 storms, we were in a situation where we just had more applications for disaster food stamps than it was humanly possible to process. And part of our innovation came out of that experience of having to come up with a better way. We then built on that experience. Then there was development of a case study because it was under consideration to privatize, and we developed an internal case study or proposal, and there were private proposals, and the governor looked at those and decided to use the insourced public sector approach rather than the outsourced private sector approach for the innovation. The savings kind of targets that you would get with outsourcing, though, we committed to. So efficiency was there, but we also wanted to improve access to our customers. The other part of it in a post-welfare reform era is to get away from welfare-centric approaches, because most of our clients, particularly families with adults, are working now. So we have to have work-centric approaches because people simply don't have time to come spend hours and days in the welfare office to get their benefits authorized.
Mr. Winston, help us grapple with a problem that we're going to be facing with this and other finalists this year. What you're doing is very commendable. As you said in the beginning, though, you got here an electronic ticket. We now find in all sorts of areas that information technologies are being applied, and indeed we have given awards in the past on this committee to, starting way back with ComStat, way back with the Giuliani administration. And so as information technologies are applied more and more widely, what becomes the innovation? I mean, how do we think about the quality of innovation when in fact what you're doing sounds very much like you're taking what somebody else is doing in another area and applying it to your area?
Welfare systems are notorious for applying 19th century solution to 20th century problems. So I think to apply cutting edge technology to our issues is in itself an innovation. I think no one has done this on the scope that we have done it, and I think that certainly is cutting edge. The final point I would make is that it is part of a fundamental change in our relationship with the people that we serve to empower them to assist in that process, and I think that's very different than we've viewed that in the past.
Thank you very much for that answer. If I might ask other finalists who are in bringing to us information technology innovations, if you could think about that a bit.